Hi everyone, welcome back to the channel. Being human, we are social animals. So, no matter how independent we become as an individual human being, we always have a need to communicate, to stay in touch, to interact with other fellow human beings. From the best moments of our life to probably the worst ones, we always need the social support system to help us sail through it. In last 1.5 years, COVID has shaken this support system for us. Social isolation affects different people in different ways. To discuss more on social isolation and its effect on our mental health specifically, today we have with us Ms. Piyusha from iCALL. Piyusha holds a master's degree in clinical psychology from University of Mumbai. Piyusha has worked with a diverse range of issues such as mental health, work, academics, self-image, relationship, as well as concerns related to gender and sexuality. She has been working in the capacity of a program officer at iCALL. So, hi Piyusha, welcome.
Thank you.
The first question that I wanted to ask is, we all know that we are facing a little bit of social isolation. Why social isolation really bothers us? If you can throw some light on that.
Yeah. So before we get into why it bothers us, I would like to just elaborate a little bit on the concept of social isolation. So social isolation basically means that we are physically and emotionally away from, our social world or from those that we feel connected with, and that can induce feelings of loneliness. We may feel, loneliness is a feeling, it's an emotion. So we may feel lonely as a result of, being socially isolated. And because of the pandemic and because of the constant lockdown, social isolation has been an issue at present, and it has induced feelings of loneliness. Now, coming to, the issue of why it bothers us, it bothers us because we as human beings are wired for social connection, right? Just like we have our basic needs of, eating, sleeping, having a place to live in, we also have certain emotional and social needs. We have the need to feel belonged. We have the need to connect with other people. We have certain emotional needs as well that we look to fulfill from other people, which is, the need to be heard, the need to be understood. So because of this situation, being physically away from people, it's become very difficult for our mind and our brains to kind of comprehend such a situation, because it has never happened before that we've been away from our social relationships for such a long time. So it's a very normal, it's a very valid response to whatever is happening around us.
As you rightly said, that the prolonged social isolation is something which we are facing right now. It was okay to not be in touch for a week or so, but then this is like almost more than a year now. So what are the risks on mental health, particularly of prolonged isolation?
For a lot of people, their coping is having a robust social support system, and not having that for a prolonged period of time, and along with that, struggling with other issues such as financial issues or job loss, all by yourself can make it all the more difficult for one to tackle with their situation, because the very way in which they would sort of lighten themselves and their feelings and thoughts, that particular source is not present. It can lead to narratives where people feel extremely lonely, and the loneliness is then attributed often to themselves, and their inadequacies or their incapabilities. It's often internalized to maybe I am not loved, or maybe I am not being good enough. So those could be some of the prolonged effects of being all by oneself for a really long time.
Is there any age group which particularly gets affected more or affected less? Like, because we have seen children and teenagers and the adults and even the elderly.
Yes.
So all of them probably go through the same thing. But is there anything that any particular age group you feel is especially affected due to this?
there was a national level survey that was conducted, and the respondents between the age group of 18 to 25 years reported feeling very lonely, especially during this pandemic. So that is the age group. And also the trends that we have seen, young people, even on the helpline, the calls that we receive, young people have been the most impacted, because this is an age where you are struggling with your academics or with your career. A lot of people live away from their homes. They're living away from their families. They are kind of figuring out their career trajectories. So that is the period which leads to the most feelings of loneliness among this age group.
What can we do about this? Because obviously social isolation is something that we never thought about, that this will come in such a way for such a prolonged time. But are there any opportunities below this thread, I would say? Is there anything that we can do and improve our life or our way of living, even being in social isolation?
Yes. So, first of all, it's important to address the feelings of loneliness that we experience because of social isolation. So, it's important to know that these feelings are transient in nature, which means that, while it is unpredictable that, when we are going to go back to our normal living conditions or when we would be able to meet people, but it's important to recognize that these are transient in nature, and these are because of the situation that we are going through, which is the pandemic situation, because that we're away from people, and to acknowledge that it's a very normal feeling to have. So that in itself is one way to kind of look at these feelings, and then to also kind of seek opportunities to also kind of seek spaces where we can feel connected, although we cannot be physically connected with someone at a given point in time, but we can always be connected to them through a virtual medium, through the use of technology, which is what we've been seeing for the past one and a half year, that we have to rely on technology to be able to have that sense of connection. And while it's never going to kind of replace the physical connections that we have with people, any form of human connection that we receive during this time is very important. So taking those small steps to initiate contact with people through a virtual medium might be helpful.
Yeah, and I think I would also like to add here that maybe this is also a time to reconnect with your family. Maybe this is also time to
Yeah,
spend some time for yourself, because I mean I get that
yeah,
not everyone would want to become a so-called introvert, but then definitely it's a good time to take care of your health. Maybe have a look at where you are, what were your
yeah,
plans. Probably audit your own life, and also with family, because I personally thought that because of social isolation, probably my family interactions were much more during this time.
yes,
I think that that's a positive thing. I mean, even if it's very small, but it's a positive thing out of social isolation. You rightly said that technology can be used
yeah.
in this extent. So what are the ways, like apart from of course Zoom meetings, so are there any other innovative ways that people can use technology?
Yeah. So there are a lot of online support groups, shared circles that you will come across. There are different, organizations that conduct weekly group sessions. So these are basically just sharing circles wherein you can just join in. You don't need to know the other person, and you can just share about your life or something significant that has happened throughout the week. So these online support groups, if you feel like you can't share certain things with your family, or you do not have those personal relationships, this is a very good option. A lot of times these sharing circles are also moderated by professional psychologists. Apart from that, there are a lot of like online games. There are a lot of platforms where you can watch movies together. You can
Yeah.
play online games together. So this not just helps us to stay connected with our loved ones, but this also kind of helps us to explore something new, to have some fun, to be a little creative. Also a time where you can get connected to friends that you've not spoken to for a really long time. So that those are some of the ways to feel connected.
What about the mindfulness? Like we always hear that mindfulness is important,
Yeah.
and it has its own place in mental health. But particularly during COVID, how do you think one can really benefit from mindfulness?
So a lot of times we have this understanding about mindfulness that it is all about meditation or sitting in one place and like meditating or just focusing on your breath. But it's a concept that is much more nuanced, and I would say much more applicable in everyday life. So it basically in simple terms means that you are aware, like there is an awareness moment to moment, and it's not just awareness of your physical body or what is happening, but also awareness of your emotions, your feeling state, as well as your thoughts. And one of the components of mindfulness is that you observe these physical sensations, these feelings, and these thoughts non-judgmentally, which means that you don't judge them, because oftentimes we feel that, oh no, if I'm feeling lonely, or if I'm feeling sad, or if I'm getting these thoughts, it's not okay to get these thoughts. We immediately pass a judgment that it's not okay to be this way. But it's important to kind of notice these thoughts and feelings non-judgmentally, and accept them as they are, like as they are in that moment.
Piyusha, thank you so much. You actually focused on many important issues, and probably we gave in a lot of tips to the viewers as well. But sometimes it might still happen that people are anxious. People are feeling that probably they are on the verge of getting depressive
Yeah.
or sad or lonely, and they sometimes it can't be handled on an individual level, and people want to seek help.
Yeah.
How iCALL can help?
iCALL is essentially a field action project, which started by Tata Institute of Social Sciences. It was started because there was a recognition of a dearth of accessible and affordable mental health services in India. Presently, we provide counseling and psychotherapeutic services through calls and emails. And interesting part about these services are they are free of cost. Most importantly, it is a safe space, because over these services we keep whatever information that is shared by callers completely confidential, and it's also an anonymous service, which means that they don't have to share their identification details when they reach out, because a lot of times people are very hesitant, very uncomfortable in reaching out when the other person is known to them in some way or the other. So it's a completely anonymous service, and there is complete assurance that whenever they reach out, the call will be answered by trained professionals. So it is not that they'll have to get connected to someone else first, seek for an appointment, and then like take the services, but directly the trained professional will be answering their call. It is a non-judgmental space, so they can talk about anything that is concerning them. We have a wide range of issues for which we provide counseling for, so they can reach out. Our helpline timings are from 10 a.m. to 8 p.m. and we work from Mondays to Saturdays. We have started a special line for COVID-19 to provide emotional support, and if people are looking for any information related to vaccines or any referral linkages, so that helpline functions from 10 a.m. to 6 p.m. It's in collaboration with iCALL and UNDP.
Okay. Okay. So I will be mentioning all the numbers and all the information. So I really urge people to make use of this service. As Piyusha said, it's free of cost. It is anonymous and you don't have to reveal your identity. So this is a safe space. Moreover, it's free. You don't need to know English or Hindi for that matter. You can talk in your language and get the help, because it's very important in this time to really stay mentally healthy. That is that is going to affect your physical health as well. And we all know that social isolation is not something that we really wished for, but now it is upon us, and we have to move forward in a little, with a little positive attitude, with a little hope that soon this will be over and we'll be back to our normal or new normal, what they call, right?
Yeah.
Thank you so much, Piyusha, for being with us today and helping us with these matters. Thank you so much.
Thank you so much, Shilpa, for giving me the opportunity.